Welcome to the Aesthetic Medicine International Congress of Agorà held in Milan. We are here with Hema Sundaram, dermatologist, which are the most important scientific data regarding the session in which you were present.
Well, my first session here at Agorà 2024 was on body injectables in collaboration with the season conference. This was a wonderful scientific session. We covered all the aspects that both experienced and beginner practitioners in this evolving arena would need to know, ranging from anatomy and safety considerations to the science, which I spoke on, particularly how science can be used to serve safety. And then we came to some practical applications of body injectables, both current and some future or new applications. And we finished with a great panel discussion. My second session after that, I was serving as a coordinator for, and that was in regenerative medicine, a very exciting, evolving, fast-paced field. And this was also of a very high scientific level. We had many interesting presentations on the new and emerging technologies. I spoke myself on the science of regenerative medicine, how we can be understanding the intricacies of DNA, RNA, and also, importantly, the regenerative capacities of hyaluronic acid and this new field of epigenetics, which is permeating aesthetic medicine. My third session was on the anatomy of the lower one-third of the face with Dr. Hamza, Dr. Lanfranchi, and other esteemed colleagues. Dr. Hamza was presenting on the key anatomy and the safety considerations for injectables. I was happy to be there as part of the panel and to be answering questions from the audience on the filler science, which is very important for the lower one-third of the face. Finally, we've had a session on vulva rejuvenation, and specifically the session I was involved with as a chair was on vulva skin. So we have many considerations there ranging from skin laxity and skin texture to pigmentation, and we have covered all these considerations with the new and emerging scientific understanding and the treatments that we can use to remediate these significant concerns.
So how much it's important to have a better dialogue between patients and doctors?
It's very important to have good dialogue, constructive and evidence-based dialogue between patients and their doctors. And a congress like Agorà can really help with that because it's giving doctors the most up-to-date information and the new and exciting possibilities not only for the present but for the future.
What did you like more about this congress in one word?
In one word, if I had to describe Agorà, I would say the heart. It's obviously an excellent scientific congress. It's a congress where colleagues come together and share their knowledge and network. And it's a very important congress not only for Italy, but now globally, internationally. But to me, what this congress shows is that it has heart and compassion. There is compassion for patients in giving the best options to the doctors who will take them home and apply them in their clinics. There is also a warmth about the interactions between the faculty and between the faculty and the attendees, and the organizers are upholding the very highest levels of safety and ethics and good clinical practice, which is reflected not only in the Agorà Congress, but also in the whole Agorà society.
And also was very important ethics and your capacity to deepen the problem of complications?
Yes. One very important connection is between ethics and patient welfare and patient safety. The Agorà Society is very dedicated to that through all its different programs, and the Agorà Congress reflects that in some very high-level scientific exchange about safety and the avoidance and management of complications during aesthetic procedures.
So thank you very much, and thank you to all of you for seeing us.
It's my pleasure.